First in our news, the World Health Organization is warning Omicron is spreading at an unprecedented rate and is urging countries to act. WHO Director General Dr. Tedros Ghebreyesus said Omicron is spreading at a rate we have not seen with any previous variant. He added that the variant is probably in most countries now, even if it hasn't been detected yet. Take a look.
77 countries have now reported cases of Omicron, and the reality is that Omicron is probably in most countries, even if it hasn't been detected yet. Omicron is spreading at a rate we have not seen with any previous variant. Evolving evidence suggests a small decline in the effectiveness of vaccines against severe disease and death, and a decline in preventing mild disease or infection. The emergence of Omicron has prompted some countries to roll out booster programs for their entire adult populations, even while we lack evidence for the effectiveness of boosters against this variant. WHO is concerned that such programs will repeat the vaccine hoarding we saw this year and exacerbate inequity. It's clear that as we move forward, boosters could play an important role, especially for those at highest risk of severe disease and death. Let me be very clear. WHO is not against boosters. We are against inequity.
Bit like with the Delta wave, when you have a large number of cases, even if that disease, as Dr. Tedros said, is slightly milder in each individual, if you have a huge wave of cases, you will see a lot of severity and you will see hospital systems coming under pressure. And Dr. Tedros' message today is to act now. His message today is to look at your health systems in the coming weeks. Make sure you have the health workers in place. Make sure you have the clinical triage in place. Make sure you've got oxygen supplies in place. Make sure that you're vaccinating the unvaccinated. Make sure you're taking every opportunity individually and at community level to stop transmission where you can. It is very difficult. This is a highly transmissible variant. It's hard to stop it. But you can take the heat out of the transmission by doing the simple things: protecting yourself, protecting your family, protecting your community, avoiding crowded spaces, wearing a mask, ensuring good ventilation, washing your hands. And the governments need to support communities in doing that by putting in place layered measures that support communities in doing that and getting the health system ready. Health workers are exhausted. Many countries have lost up to 20% of their health workers. Health systems are weaker now than they were a year ago, in reality. So, unfortunately, sometimes you can get up after the first punch, but it's very hard to get up after the second and third, and that's the difficulty. We're relying on health workers and a health system that have been weakened by this response, and Dr. Tedros' concern is that we don't be complacent. We don't wait for it to be overwhelmed by a wave of cases. We have some time to get better prepared. And to make sure our systems are able to cope.
Some of the early data and the outbreak has occurred in very young age population, where they look at the data from the UK is between 2029. An early outbreak in South Africa was in university cluster. So the concentration of the age group may give some people false reassurance that's a milder. We don't know. The greatest risk for SARS-CoV, for COVID, has been age. So how do we protect our elderly population? At high-risk population would be very critical, as Mike said. We really, really need to prepare.